Hello everyone and welcome back. In this video, I want to talk to you about treating a substance use disorder in patients with cancer. So this kind of hit home. I had my own scare very recently. Spent a couple of months worrying if I had an issue. Thank goodness I'm good. But you get a little older. I just turned 59 and you start to worry, right? Especially when there's a family history. And we just sort of get older and things start to break and we don't recover as well. So you have to take better care of yourself. So I saw this article and I thought it was very, very interesting. And I'll put a link to the article in the description. Recent studies find that nearly 1 in 10 adults suffers from a substance use disorder at some point in their lives. What do you do if a patient is embarking on cancer treatment and is also struggling with a substance use disorder? Understandably, managing a patient's substance use disorder concurrently with cancer treatment may feel overwhelming for oncology providers. However, there are many strategies and tools to help patients through this challenging journey. And they list a few things here. They talk about, the stigma. The stigma associated with substance use can hold patients back from discussing these issues. Yeah, with all the sort of the advances that we've had over the years, and how much more open we've become about discussing substance use, in fact, any behavioral health, substance use, mental illness, there's a certain amount of stigma and perhaps embarrassment and shame and things of that nature. And it says there's some methods to encourage patients to be comfortable talking about substance use disorders include creating a safe space, asking open-ended questions, and this is an important one, approaching patients with compassion, because you've got somebody here who's dealing with a life-threatening disease and perhaps they're drinking too much. And the last thing we want to do, obviously, is attack, right? And I think that is an interesting way of looking at things. And it says here, for example, it can be risky for a patient starting high-dose chemotherapy when they're heavily using alcohol. We need to educate them about the impact it can have on their cancer treatment. It is important to let them know that we're concerned about keeping them safe and that there are programs that can safely help them through withdrawal. Engaging family members, talking to the family, and actively listening. Just great tips. It also goes on to talk about exploring treatment options and approaches. So I'll let you read this for yourself. I'm not going to read the whole thing to you, but I think you get the point, right? If you've got somebody who's actively trying to treat cancer, and they're also dealing with a substance use disorder, perhaps it's alcohol, perhaps it's marijuana, whatever it happens to be. I think this is an interesting article for you to read, but you can't obviously you can't ignore the cancer situation, but you can't ignore the substance use disorder either. That has to be addressed too. And so if that is something that you or your family is dealing with, let's talk to you. Let's see what options may or may not be available to you. I'd be interested to hear your take on this, whether you agree, whether you disagree. As long as we're all respectful, I'm good with that. And I actually just really appreciate the interaction that you give me. Thank you for that. And, tells me that you take a little time to hear what I have to say, even if you don't agree with me. And I'm grateful for that. If there's an issue that you're seeing in your family and you'd like me to address it, I'll make a video for you, because if it's affecting your family, good chance it's affecting somebody else's, and we want to make sure that you get the information that you need. If you like this content, please give me a thumbs up. If you want more of this, because I put out a video or two just about every single day of the week, then please subscribe to the channel. And with that said, thank you for tuning in. I'll see you in the next video. Bye-bye.